Hello and welcome to Mindful Health Fitness, the channel where we talk about how to improve your physical and mental well-being. I'm your host, Bing, and today we're going to talk about everything you need to know about depression, also known as Major Depressive Disorder. Depression is a common and serious mood disorder that affects how you feel, think, and act. It can cause persistent feelings of sadness, hopelessness, guilt, and loss of interest in things you used to enjoy. It can also affect your sleep, appetite, energy, concentration, memory, and physical health. Depression is not a sign of weakness or a character flaw. It's a real medical condition that can be treated with medication, therapy, or both. According to the World Health Organization, more than 264 million people of all ages suffer from depression worldwide. Depression is the leading cause of disability and a major contributor to the global burden of disease. Depression can also increase the risk of other health problems, such as heart disease, diabetes, and substance abuse. The causes of depression are not fully understood, but they may include genetic, biological, environmental, and psychological factors. Some of the risk factors for developing depression are having a family history of depression or other mental disorders, experiencing stressful or traumatic life events, such as abuse, loss, divorce, or financial problems, having a chronic or serious medical condition, such as cancer, diabetes, or chronic pain, taking certain medications that can affect your mood, such as steroids, birth control pills, or blood pressure drugs, having a personality trait that makes you more prone to negative emotions, such as low self-esteem, pessimism, or perfectionism, being female, as women are twice as likely as men to suffer from depression, being older, as depression is more common among older adults. The symptoms of depression can vary from person to person and may change over time. Some of the common signs and symptoms of depression are feeling sad, empty, or hopeless most of the day, nearly every day, losing interest or pleasure in activities you used to enjoy, having trouble sleeping or sleeping too much, feeling tired or having no energy, eating too much or too little, feeling restless or sluggish, feeling worthless or guilty, having difficulty thinking, concentrating, or making decisions, having thoughts of death or suicide. If you have any of these symptoms for more than 2 weeks and they interfere with your daily functioning, you may have depression and should seek professional help. Depression is not something you can just snap out of by yourself. It's a serious condition that requires treatment. The good news is that depression is treatable and most people can recover from it. There are different types of treatments available for depression, such as medication. Antidepressants are drugs that can help balance the chemicals in your brain that affect your mood. They can reduce the severity and duration of depressive symptoms and prevent relapses. However, they may also have side effects and interactions with other drugs. You should always consult your doctor before taking any medication and follow their instructions carefully. Psychotherapy. Psychotherapy is a form of talk therapy that can help you understand and cope with your thoughts and feelings. It can also help you change your behavior patterns and improve your relationships. There are different types of psychotherapy for depression, such as cognitive behavioral therapy, CBT, interpersonal therapy, IPT, or psychodynamic therapy. You may work with a therapist individually or in a group setting. Brain stimulation. Brain stimulation is a treatment that uses electrical currents or magnetic fields to stimulate certain areas of your brain that are involved in mood regulation. It can be an option for people who have severe or treatment-resistant depression. Some examples of brain stimulation are electroconvulsive therapy, ECT, transcranial magnetic stimulation, TMS, or vagus nerve stimulation, VNS. In addition to these treatments, there are also some lifestyle changes and self-care strategies that can help you manage your depression better. Some of them are exercise. Physical activity can boost your mood by releasing endorphins and serotonin in your brain. It can also improve your physical health and self-esteem. Aim for at least 30 minutes of moderate exercise 3 times a week. Diet. Eating a balanced diet can provide your body with the nutrients it needs to function properly. Avoid foods that are high in sugar, fat, or caffeine, as they can worsen your mood swings. Eat more foods that are rich in omega-3 fatty acids, such as fish, nuts, or flax seeds, as they can have anti-inflammatory and antidepressant effects. Sleep. Getting enough sleep can improve your mood and energy levels. Try to establish a regular sleep schedule by going to bed and waking up at the same time every day. Avoid napping during the day and limit your exposure to light at night. If you have trouble falling asleep, you can try some relaxation techniques, such as meditation, breathing exercises, or listening to soothing music. Social support. Having a strong support network can help you cope with your depression and reduce your sense of isolation. Reach out to your family, friends, or other people who care about you and share your feelings and experiences with them. You can also join a support group or an online community where you can meet other people who are going through the same thing as you. Hobbies. Engaging in activities that make you happy or give you a sense of accomplishment can boost your self-esteem and distract you from negative thoughts. Find something that you enjoy doing, such as reading, writing, painting, gardening, or playing an instrument, and do it regularly. Help others. Helping others can make you feel good about yourself and increase your sense of purpose and meaning. You can volunteer for a cause that you care about, donate to a charity, or simply do something nice for someone else. Depression is a common and serious mood disorder that can affect anyone at any age. It can cause a lot of pain and suffering for yourself and your loved ones. But it's not your fault and it's not something you have to live with forever. There are effective treatments and coping strategies that can help you overcome your depression and live a fulfilling life. The first step is to recognize the signs and symptoms of depression and seek professional help as soon as possible. You are not alone and there is hope. Thank you for watching this video. If you found it helpful, please like, share, and subscribe to our channel for more videos on health and wellness. And remember, be mindful of your health and fitness. See you next time.